Adding to the growing body of literature on this topic, there was a paper that was published yesterday that shows that patients have better long-term outcomes when they're operated on by female surgeons. This was published online yesterday in one of the most renowned journals in medicine, JAMA. It was a retrospective review of patients that were operated on between 2007 and 2019, and it looked at long-term outcomes. Now, previous 30-day outcomes have already been examined, but this is specifically looking at 90-day and 1-year post-op outcomes. Now, this study reviewed over 1 million patients, and 23% of those were operated on women, and 76% of those were operated on by men, which means there was about 150,000 patients that were operated on by female surgeons. They also looked at these covariates, including age, sex, comorbidities, geographic location, and socioeconomic status. So specifically looked at surgeon level data, including, again, their sex, their age, their years in practice, specialty, and their surgical volume. Now, after adjusting for all of those covariates, they observed higher complication rates at 90 days and 1 year of those that were operated on by male surgeons as compared to those that were operated on by female surgeons. Well, this is not to point fingers, but really we need to understand, why is that? We think that it's because that female surgeons are more likely to use a patient-centered decision-making. They're more likely to collaborate and be more careful about who they select that's appropriate for what surgery. And that's extremely important when you're trying to prevent postoperative complications. Essentially, providing the best postoperative outcomes to patients means choosing the right patient for the right surgery, and that means listening to them and helping in the decision-making and understanding what it means to have a specific surgery and recover from that successfully.